Good afternoon, everyone. Welcome back to Build's first home-based childcare webinar of 2023. We are so glad to be back and excited to continue this work together with you. As always, I'm joined in this work by Gina Capito, and my name is Danielle Fuentes Johnson, and I'm with the Build Initiative. Right, well, let's take a look at the agenda for today. First, we're going to welcome you. We're going to have, in just a minute, we're going to have a couple of polls to kind of get a sense of who's here today. And then we're going to welcome Katie Kenyon as she shares her research and highlights from Build's new brief, State Scan of Family, Friend, and Neighbor Policies and Supports. Then we'll welcome Dr. Susan Savage and Olivia Pilado, who will share what they heard directly from family, friend, and neighbor educators and the families who rely on them in the Los Angeles area. And then we'll conclude with some next steps, including what's coming up in the next couple of months. Right now, if we can go to the next slide, we'd like to take a quick snapshot of who's here today. And then also the second slide, or the second poll, we'll take a look at what your connection to family, friend, and neighbor care is in your experience. So we'll go ahead and launch number one and give everyone a moment to fill that out. And if you don't see the option that best suits one of your roles, go ahead and write it in the chat, please. And as we think about this topic today, think back on your experience, whether or not you were cared for by a relative, family, friend, or neighbor, if you've provided that care in the past or currently, or if you have someone that's close with you who provides that level of care. All right. Fantastic. Well, while you're finishing that poll, I'm going to turn it over to Gina Capito, who's going to remind us of Build's core beliefs around home-based childcare, and we'll share out some of the results.
Hi, everyone. Thanks, Danielle. Good to see so many folks joining us today. We're excited to dig in more related to family, friend, and neighbor care, which while you're taking a minute and doing that second poll, I know it was a little delayed for me. It just came up on my screen. I'm going to pause and just highlight that one of the things that we want to talk about as part of our core beliefs is also the idea of terminology and acknowledging that across different systems, different states, different communities, we use different terms. Some of us refer to family, friend, and neighbor care. Sometimes you hear folks say kith and kin, you hear license exempt. Really depends on your vantage point. It depends on maybe what role you have within your community or system. And that one of the approaches that we have used across this work is to be all-inclusive of sort of any sort of childcare that's being delivered in a home setting. And so you hear us use the term home-based childcare, family childcare, license exempt, family, friend, and neighbor. In this particular setting, we are going to, in this webinar, really unpack family, friend, and neighbor as defined as more of those license exempt settings, programs that have not gone through the licensing system, so generally are held to a smaller number of children, or more children, but they have to be related to the person who's providing care for them, which is not the same as a licensed family childcare setting. So in this particular session, that idea of terminology does have a particular lane that we're getting in. So when you hear Katie and the other speakers start to unpack some of what they've learned about family, friend, and neighbor, some of it is those differences in terminology, but there's certainly sort of a particular type of care that we're talking about with this paper, as well as the content that we're going to be sharing. It looks like we have wrapped up the poll, so I'm going to go ahead and then talk more about the core beliefs. Let's take a look at those on the next slide. These are constants in the work that Build does around supporting home-based childcare, and there's several things that we feel are really important to thinking about how we approach this work as a system, and that we attempt, as we're doing the work together, bringing topical areas to the webinar series. But one of what we're really aiming to do is find ways to continue to highlight these core beliefs, kind of bring them to the forefront, discuss them as a group of leaders in family childcare and home-based childcare space. And we're supporting you in areas that we have heard again and again are really critical to ensuring that family childcare and home-based childcare settings are truly, just core belief number one, part of the fabric of the early care and education system in any state or community, and that in order to be a true mixed delivery system, that family childcare settings need to be as embraced, resourced in the same way, supported in a way with strategies that are reflective of the type of care family childcare providers provide to children and families, the business model that they provide and the way that they work, which is naturally different than school or center-based settings, and that the strategies and ways in which our systems partner with home-based childcare settings need to be reflective of that as well, that need to be really tailored and unique in the approaches, and that the voice of home-based childcare providers and owners needs to be driving those sorts of changes and strategies. So that speaks a lot to the idea of resourcing in core belief number 2. In core belief number 3, the idea of how the types of supports and training and when those things are offered and the manner in which they're done is driven by the voice of the family childcare and home-based childcare providers themselves. And that we need to be thinking about all of the different opportunities as far as different funding streams and how we are using that mixed delivery system that we believe to be true, and that family childcare is a core value in that mixed delivery system, that we are really thinking about how we leverage the funding to support that, and how we find ways to make it that it's not, we do this for center-based, so this is what it looks like for family childcare too, but instead that we're really intentional and thoughtful in that process. And that's probably one of the overlying sort of underlying elements of our core beliefs, is that intentionality. So if we go to the next slide, that gets us into that terminology a little bit more. And you heard just on the core belief slide that I use home-based childcare and family childcare both, right? And so naturally, interchangeably in that instance. But as I mentioned earlier, there is part of our approach is to ensure that we are being inclusive of all the different ways in which home-based childcare is offered to families in communities. So we know that because states and communities have different systems and different approaches to this and definitions, there are different terms that are used. We frequently move in and out of the terms in order to be as inclusive as possible in the resources and the ideas that are being shared and the discussion that we're having. But in particular today, we're really excited to be digging in more specifically on the concept of family, friend, and neighbor care, and bringing up some strategies as well as deeper understanding of family, friend, and neighbor care as a concept, as part of this much bigger system. So I think with that we are ready to jump into the content. Oh, Danielle, did you want to give a little voice to the polls responses?
Yeah, we can take a quick look. Let's take a look. Let's see if we can publish that. Wow, it looks like the majority of us have either someone in our lives who provides this care, or we're cared for in this capacity, which really makes it personal for many of us. And then let's take a look at poll number 1. I can't get that one to come up. We'll try and show that one later in the session. But for now, we'll turn it over to Katie, and we're looking forward to hearing what you found.
Great, thank you. Good afternoon, everyone. Just wait a second for the, I don't see my slides yet, but I don't know if it's there you go. Okay, awesome. So as Danielle mentioned, I had the pleasure of working with Build on a scan of what states are doing to support family, friend, and neighbor. And you can go to the next slide just to give a kind of sense of what I'll be talking about, the project purpose. Even more conversation about definitions, unfortunately, requires lots of conversation about definitions. Then going into some of the state policies and supports, and then making the transition into the conversation about Los Angeles County and what they found. So we can go to the next slide. Thanks. So really the purpose of this project was to begin to gather state by state information about ways in which FFN providers are being supported, and share that information so that it could be a resource to others, and hopefully lead to more supports and resources going to this critical part of our early childhood ecosystem. So this initial report will be released soon, and we're hoping that you all and others will help add to it, update it, maybe correct it, and use it on an ongoing basis. So really, why is it so important that we focus on FFN care? FFN care, as many of you know, is the most common type of childcare in the US, as our poll, I think, demonstrated. It's estimated that more than 4.5 million FFN providers are in the US, And while all socioeconomic groups and racial ethnic groups rely on FFN care, it's especially common among lower income immigrant refugee families and those whose primary language is not English, as well as families with needs that can't be met by the typical licensed childcare, such as those who work non-traditional hours, those living in rural areas, families with children who have special needs. And all ages of children are in FFN care, but it's particularly common for school-age children, so that before and after school care, and infants and toddlers. And while we know that there was a dramatic decline in the licensed home-based childcare or family childcare between 2012 and 2019, the number of FFN providers increased during the same period. We also know that reliance on FFN care increased during the pandemic, and many families may have chosen to continue with their FFN providers because of the many strengths of this type of care, especially that these providers are often able to meet the family's needs, as I mentioned, better than any other form of care. So we also know that FFN providers are in need of support. For example, the Rapid Childcare Survey led by Dr. Phil Fisher at Stanford recently found in their national sample that 34% of FFN caregivers are experiencing hunger, and that many of them are struggling to afford basic necessities themselves, which obviously it would impact their ability to support the families that they're helping. So given the growing reliance on FFN caregivers and knowing how these caregivers are struggling, it's really important, more important than ever, that we find ways to support them. You can go to the next slide. So FFN caregivers are unlicensed caregivers who provide regular care for children with whom they have a prior relationship, either as a family member, a friend, or a neighbor. And as Gina said, many different terms are used to refer to unlicensed home-based care, including unregulated, unlicensed, license exempt, kith and kin, relative care, among others. And as I will share in a moment, the terminology used and even the definitions of the same term differ depending on the state and sometimes even the county or the city in which one lives. So we can move to the next slide. So there's a growing body of research about FFN providers, especially those FFN providers who are serving children with subsidy. Most FFN providers are related to the children they serve, and the vast majority of these relative caregivers are grandmothers. And we also know that FFN caregivers are disproportionately women of color, low income, immigrant or refugee, and limited English proficient. So it really sets the stage for how supports need to be provided to this population. Despite their own lack of resources, FFN providers, like home-based childcare in general, have many strengths, and these are often the reasons why parents rely on and are happy with their children being in this type of care. So most FFN providers are doing it to help a family or friend. That's how it starts, and because they love the children they care for. Most view it as a temporary role rather than a career, and most of the over 4.5 million FFN providers in the US are not on any list or registered in any way. So you can go to the next slide. So as I mentioned, it's really important to talk about these definitions and about regulations because of the different regulations in different states. And in some places, like I said, even cities, the line between FFN and licensed exempt home-based, the line between FFN and licensed home-based childcare or family childcare is really blurred. One type of care may be regulated in one state and not regulated, the same type of care not regulated in another state. And as I mentioned, at least one state, you could cross a city, you can be in one city and you must be licensed, in the next city, you don't need to be licensed. So in this example, take a grandmother who cares for her 4 grandchildren and 2 of their neighbors' kids in her home every weekday while their parents are working. So I just pulled, the report goes state by state, but I just kind of started at the beginning of the alphabet just to demonstrate this. So from the red X on the right, you can see that grandma would not be exempt in Arizona, Colorado, DC, and Delaware. In Arizona, because she's caring for the kids in her home and not in the children's home. In Colorado, DC, and Delaware, you can only care for a maximum of 4 kids without being licensed. She would not be license exempt. And in other states, it can depend on other factors, as I'll show you in the next slide. So in this example, Velma loves children and cares for her friends' 3 children while their parents are working. In Arkansas, she's good. She can just care for those kids and she doesn't need to worry. In Alaska and Alabama and Florida, only relatives are exempt, and Connecticut as well. In Arizona, California, Colorado, DC, and Delaware, it depends on additional factors. So in Arizona, it depends on if Velma is paid and where she provides the care, she is exempt. If she's paid and provides the care in the child's home, she's exempt. In California and DC, it depends on if the children are from the same family. If they are, then the care is exempt. In Colorado and Delaware, it depends on the age of the children. Only 2 of the children can be under age 2 and the care be exempt. So y'all got that all straight? It's clear as mud, right? So I think we really, when we step back, we have to ask ourselves and our policymakers, what purpose do these regulations serve? And are they meeting the purpose that they were designed to be implemented for? Are they actually helping families and the caregivers who serve those families? And most importantly, what are the unintended consequences of these policies? So really important to, as I said, before we even talk about the supports, it's really important to define who we're talking about, because some of the supports are only available to those providers who are exempt and on a list and known. Most of them, in fact. So we can go to the next slide. I'm just going to take a sip of water. Like everybody, I'm getting over cold. So what policies and supports exist across the country? As I mentioned, the paper will go into that, and we can go to the next slide, actually. So this diagram kind of is providing a summary of what's included in terms of the state policies and supports. And at the center of the diagram are policies that allow children who are cared for in FFN settings to benefit from federal programs for which they are eligible. So in particular, the Child Care and Development Fund, or CCDF subsidies, and the Child and Adult Care Food Program, or CACFP in particular. I put that in the center because in many states, these policies are what enable folks, the FFN, to be known by the system. And in many cases, that serves as sort of the scaffolding on which additional supports can be provided, such as the others listed in the diagram, and that I'll go into in more depth. Okay, we can go to the next slide. So over 75% of states allow children receiving CCDF subsidies to be cared for in some FFN settings, those that are legally unlicensed or exempt, which you now know varies widely state to state. So in terms of CACFP, the Federal Nutrition Entitlement Program that reimburses providers for meals served to children in their care, FFN providers are typically enrolled and monitored through a sponsor agency. So CACFP requires that programs be licensed or approved to participate, though many states choose not to create an approved designation, thus precluding FFN providers from even participating. The differences in how families and FFN providers learn about these opportunities and benefits, you can imagine, with the definitions being confusing, but also, you know, who are these providers and the families they serve? They're the ones who, in many cases, are not known to the social services, and so they may not, you know, be computer literate. They may not speak English fluently. They won't know to search for these opportunities and benefits, even if they are eligible. And CACFP sponsor agencies are essentially gatekeepers to the program, and they don't have sufficient funding or incentive to really do the kind of high touch outreach and support in multiple languages in a way that is culturally appropriate, to really reach these providers. So the report goes into examples here. I just pulled a few. In Georgia and New Mexico, they're including FFN in these programs, like many states. And in New Mexico, it's interesting. They require that all FFN providers serving children with subsidy participate in CACFP, and they provide funding to do that. So we can move to the next slide and move on to licensing supports. So with the decrease in licensed home-based childcare or family childcare over the past 10 years or so, many states have increased their efforts to encourage and incentivize and provide support for individuals to become licensed and start a licensed childcare business. And many states are focused specifically on FFN caregivers. The problem with this strategy, of course, is that a very small portion of FFN caregivers are interested in becoming licensed. Although, so in one, Danielle and I talked to a number of different efforts across the country, and we asked the question, like, what percent would you say? It seemed to be around 10% anecdotally of providers that at least they come in contact with. So, you know, that said, there is that 10% who really just have never thought maybe about starting a business, and with encouragement and lots of hand-holding, they become interested and see it as an option. And this strategy really includes outreach and recruitment, which is often limited to those who are registered or at least legally licensed exempt, although some efforts actually do go out into the community, to schools, to parks, even laundromats, to really reach FFN providers who aren't already a part of the system. They provide orientation and training, they help with fees and other payments, provide supplies and materials that may be required to become licensed, and most importantly, that hand-holding and encouragement and mentoring to get them through all of the hoops that are required to become licensed. And provide a couple examples here. Louisiana was successful in increasing the number of FFN by making it simpler and more streamlined. So really focusing on the process. And then they partnered with R&Rs to reach out to FFN providers in the state to encourage them to become registered and then be part of the program. Excuse me. Okay, we can move on to the next. So there's a growing movement to allow home-based childcare providers to unionize. And from my research, unions in at least 7 states include FFN in those unions, those who serve children receiving public childcare subsidies. And then there are a couple of examples in California, where I'm from. The governor reached a collective bargaining agreement with Childcare Providers United, and which also includes the license exempt FFN providers, we call them license exempt in California, who serve children receiving subsidy. So this includes increased reimbursement rates and a commitment to move to a single reimbursement rate system within the state, which will hopefully increase rates over time. So then we can move to the next one. Another strategy highlighted in the report is including FFN in QRIS in some capacity. 12 states require that FFN providers serving children receiving child care subsidy participate in the state's QRIS in some way. One example is in Michigan. They use QRS as a mechanism to ensure those FFN providers who are serving children receiving subsidy meet the CCDF requirements. All FFN providers are required to register in the statewide registry, attend an initial 7-hour training and ongoing health and safety refresher course each year. They receive a mandatory health and safety site visit from their license exempt provider coach. And they also receive a higher reimbursement rate if they complete additional hours of training through the registry. So just one of the examples. We can go into the next one. With the recent influx of federal childcare stabilization funds, many states and counties and cities even saw this as an opportunity to invest in and include FFN providers, which is great. For example, in Arizona, FFN providers were included in this Child Care Stabilization Grant Program, as well as a temporary wage enhancement. So they were able to maintain or increase their own wages up to $750 a month through June 2023, as an example. And then lastly, the report also includes highlights some local models that are really interesting and innovative, many promising strategies out there. And there's also a growing body of research and evaluation of many of those programs. Most of the studies look at programmatic interventions, like the ones listed here in the slide, and trainings and workshops, play and learn groups, and most of the models that are out there use some combination of these strategies. So that is in the report as well. And I'll just say that, as I mentioned, this is hopefully a first step in this report. And if anybody finds anything that is missing or incorrect, I hope that they will reach out and be a part of making this a really useful resource for others. So I will pass it back to you, Danielle. Is that right?
Yeah. Thank you so much, Katie. We know this is just scratching the surface. We've put the link for the new brief in the chat. Jonathan, can we go to the next slide? Actually, thank you. And with that, we'd like to turn it over to Susan and Olivia to tell us about what it looks like in one community in the Los Angeles area. So Susan and Olivia, we're looking forward to hearing what you have to share.
Thank you so much. I'm so excited to be here this afternoon with everyone. This project was funded by First Five Los Angeles and conducted in partnership with the Child Care Alliance of Los Angeles, which is a partnership of 10 agencies, resource and referral, and alternative payment agencies across Los Angeles County. Next slide, please. So again, as you heard Katie talking about, there are so many different definitions, and I just want to lay the foundation of what we're going to be talking about today in our presentation, my presentation with Olivia Piatto. First off, family, friend, and neighbor providers in this presentation is talking about those who are friends, family, neighbor, who are not licensed by the state, but are legally able to provide care. Some are paid, and through that payment from the state are often what you might be called registered because they're connected to a state organization. Others are paid, much like I had my own family and friend provider. I paid out of my pocket, no state reimbursement. Others do it for no pay. And so there's a wide range of family, friend, and neighbor providers. But in this study, we're talking about those who are not licensed. And in contrast, those who are licensed are called family child care providers in this study, who are licensed to provide either a small daycare home for 8 children or 14 for a larger home, undergo background checks and a review process, as well as some required trainings. Next slide, please. Those who choose home-based care intentionally. Some people seem to feel mistakenly that this is the fallback for parents. No, parents choose home-based care intentionally. They choose it often because it fits their income needs. So you see that with modest income families. You see that with families of infants and toddlers. They might not want to have their infant or toddler in a larger setting. They intentionally choose home-based care. We often find families who are typically marginalized in these care settings. Families who have children with special needs and need specialized care. Again, those smaller environments really are a comfort to these families. Often rural families where there aren't licensed centers or homes will intentionally choose the family, friend, and neighbor non-licensed care. Also, those who have linguistic needs and want that cultural linguistic match will choose intentionally these settings. Now, many of these providers live in what you might call a licensed childcare desert, much like I just mentioned with rural areas. If there isn't a lot of licensed care, you need the other part of the infrastructure to be there for parents who need that type of care. Quite often, those families will work non-traditional hours, and those with a home-based setting will be there for those families. And it's a very good fit for those families. Unfortunately, little is known. It's starting to flourish. Research on this type of setting, the home-based setting, whether it's the licensed or the not licensed. But we need to really learn more because, as I've described here, these families, it's important to uplift these providers to ensure equity and social justice and access to care that is needed by these types of families. Next slide, please. I'll go into our study and turn over to Olivia in a minute to describe some of our specific results from this study. Next slide, please. This was the beginning part of a 5-year strategic partnership between First 5 Los Angeles and the Child Care Alliance of Los Angeles. The first part of this landscape study was looking at the study of the landscape of Los Angeles County providers and engaging a provider advisory group all along the way to intentionally inform the entire process from planning to implementation to evaluation. The next start was to learn from this analysis and learn from this provider group, giving them full voice, to then begin to design pilots to implement across Los Angeles County. Then to learn from lessons from implementation of those pilots, what's working, what do we need to change, and what do we need to take to scale to improve the success of the home-based childcare population across Los Angeles County. And then look at what do we need to ensure the sustainability in terms of systems change and policy. Without looking at that broader picture, we're just going to make tweaks along the way. And we really need to look at broader policy to ensure sustainability over time. Next slide, please. The research questions that guided this particular landscape study that is part of that phase 1 that Olivia will be talking about had these research questions. The first research question is, who are the providers? We need a landscape of understanding who's out there providing this care and how do they view their job. Second research question, how do they access resources, services, supports? Also, what are their needs? What are their barriers to success that we need to remove or deal with? How has COVID-19 affected their experiences and the experiences of the families they serve? Who are the children and families who intentionally choose these environments, and how do they view their provider? And finally, what are the policies that are needed to build a sustainable home-based childcare sector for the future? Next slide, please. And now I'll turn it over to Olivia to describe a little more detail about the study and our findings.
Thank you, Susan. So we are actually going to share very little bit because there's a lot of data, and we expect the report to be ready in about the next month. So that definitely will be shared with you all. But just to give you an overview of this study, it launched in the spring of 2022 with a survey that went out to home-based providers who take care of at least one child 5 years or younger, and to parents who had at least one child 6 years or younger, with the home-based care as a primary child care arrangement for a child, at least one child. 6 years or younger. The surveys were distributed electronically, and providers and parents had the option to complete the survey in Armenian, Chinese, Spanish, or English. And as a result, we got back almost 2,000 surveys, with 459 of those from the family, friend, and neighbor group. We then provided the option to opt into further research activities. So for family, friends, and neighbors, those were key informant interviews. And for parents and family child care providers, those were, that was participation in focus groups. And we had a total of 30 family, friend, and neighbor interviews and 13 focus groups. All were conducted in either English, Spanish, Mandarin, or Armenian. So we did have different language groups in each of those activities. We also wanted to ensure that we kept the community engaged and offered the community an opportunity to work with us to interpret the findings from the study and to also start working on recommendations for the future together. Because we wanted to accomplish that goal, we had 10 listening sessions across the county with various different groups, family child care providers, family, friends, and neighbors, parents, and organizations that work with home-based child care providers and the families who use home-based care. Next slide, please. And today we're going to be focusing on just the FFN group, but we did put up all of the data to share with you. As you can see, we did get a good diverse group of FFNs who responded to the survey. This is the middle column here. We did over target African-American groups, both all in the FCC, FFN, and parent groups. And so that 28% is a result of work to ensure that the Black and African American community responded or was included in this. We know that we have a lot more work to do with the Asian and Asian American community. Next slide, please. One thing that we did find, and a lot of our results are validating to what Katie just shared and what we know about FFN and FCCs, but one thing that I do want to share here that really stood out to us was how distinct the FFN group is from the FCC group in particular. They are a lot less resourced, less likely to have a partner, less likely to own a home than the FCC group. And so it really is important to acknowledge and recognize, especially when coming up with supports and ways in which to support them, that they're not the same group as the FCC group. Next slide, please. So a little bit more about what we learned from the FFN groups. A large percent of them are likely to provide non-standard or care during non-standard hours, including weekends. Most serve school-age children. A majority of those who responded were related to the child, with a little over 50% saying that they are the child's grandparent. And as you see, a lot of what we'll share really are going to point towards the idea of perhaps using a family support model to support FFNs in the work that they do. Next slide, please. We were interested in knowing about the motivations for why they take care of children. And I'll again just point out the first bar here, with 75% of the FFNs said that they did the work in order to support children's parents, their own family members, or their friends. Again, motivation very different from what the FCCs told us when we talked with them about their motivations. Whereas for them, it was more of a personal calling or career. Next slide, please. And when we asked about professional development, we were interested in what is the level of participation in professional development. So this is specifically in the prior 12 months, had they participated in any webinars, any trainings, college courses, anything like that. 72% of the FFNs said that they do not participate or had not participated in any of those professional development activities. And a high percentage, 30%, said, I don't have any barriers. One of a few of the themes that we heard over and over again was, well, why would I go to professional development? It's my family. I've raised children before. I'm an expert in this area. Or if I do take professional development, it's going to be for my career. So my career is I am a promotora, and so I do that instead. Or I am in the healthcare field, and so when I take professional development, it's in that area. But we did hear some of the challenges for those who did express other challenges in participating in professional development, with lack of time, time and location of the service, and cost of service being at the top barriers. Next slide, please. In terms of greatest challenges in general, again, a lot of this is validating what we already know about FFNs. One of the top challenges that we heard is the low pay. And this theme came in concert with the idea that FFNs are in this to help the families that they're helping. And so we did hear a lot of, I wouldn't take care of other children with the amount of pay that I receive. That I take care of these children because they're my family. We had some who actually did the math and said, after I do the math, I know that I only get paid this much. So that's a theme that we heard. COVID was still a stressor in terms of the stress of contagion, the stress of managing childcare during time of COVID. And then when we delved into what the greatest expenses were in taking care of children, food and rent were the two that surfaced to the top. Next slide, please. And I'll just let you digest this one, but it really speaks to the pay as an issue. Next slide, please. We saw multiple themes during, we saw multiple themes as we did the interviews, the surveys, the convenings. Food is one theme that came up consistently. And it was very interesting because it was very clear that this was a need, but the FFNs, they're so humble that, you ask them what they need. They may not say that they need food, but we always hear, I provide food. Food is a struggle. It came up in terms of COVID when the family was struggling with COVID and somebody got infected. I cooked for them. I went and I dropped off food at their home. A lot of these themes really point to that permeable line between childcare and family. And so as a major theme, that's something that we saw consistently. Any increase in pay for the FFN didn't go to pay myself, it went to pay for a child's, for more food, for the child needed clothing or the child needed food, anything that was needed in terms of childcare, more activities, materials, things like that. COVID, that line between childcare and family really blurred during COVID. We had a few instances where the FFN said the family got infected, and so I said, bring the children to me. I'll take care of the children while if you need to quarantine away from them, that's the way that you can do it. And we also saw this in terms of the length of time that the FFNs intended to take care of the children that they care for. When we asked them, the most frequent response was, as long as the family needs me. And so that may be because the child is going to age out and go to school, or the child may not have a need because of a different employment or no longer in school, whatever the need is. It typically depended on what the family was going to need. Next slide, please. So I'm going to hand it over to Susan to share some of the recommendations.
Thank you, Olivia. First, 6 recommendations bubbled up from our conversations with providers, as well as the data from the surveys, focus groups, key informant interviews. We took the data back to them and they told us, is this, on board with our experience or not? And a lot bubbled up that we added on in addition to what we found from the surveys and focus groups and key informant interviews, taking the data back to them. First off, involving the providers with every step of the way, from planning to implementation to evaluation, needs to happen to ensure equitable, relevant, cost-effective programs, or else we're going to miss the mark. We're going to create programs that just are not relevant to them. As you heard Olivia say, we need to think about distinct systems for FFN providers compared with FCC providers, because they are so unique in their needs, their experiences, and what they provide families and their success stories. We need to be thinking about new models for engaging providers. They are, and Katie mentioned that some are really hard to reach if they're not tech connected, if they're not in a subsidy system. Those are most of the family, friend, and neighbor providers out there. And so we're going to need to think about, how do we fund that model of engaging providers if we really want to affect the lives of most of our children? We need to ensure that our models are seamless, responsive, and holistic. Again, we have to start with the basic needs before we get into professional development. And we can't put it on the backs of the providers to know this program exists. So we have to reach them, not put the burden on them to reach us. We need to really think about that mixed delivery system and ensure that they are involved in every step of the way and that they have livable wages. Again, going back to those basic needs. And finally, we need to develop strategic partnerships that include the providers, the CBOs in our communities, philanthropy, and government. We all have a role to play to ensure the sustainability of the home-based childcare population. Next slide, please. I'm going to dig into 2 of those 5 reports coming out. You can dig into all, actually 6 of the recommendations when that report comes out. Really wanted to hone in on the distinct systems. You saw that the FFN providers and the FCC providers look very different, and families choose them for specific reasons. And because they're so distinct in their resources, their motivation for providing care, and their needs, we need to be thinking about family service models versus professional development models and think about how to fund those differently. You heard about the home visitation, play and learn groups, basic need support, whether it's direct cash transfer. Homegrown is doing some pilots with that, and really thinking through, how does that have to look very differently. Also leverage the existing connections. FFN providers offer a wealth of after school care. And so why are we not going and connecting with the K-12 groups to ensure that we connect those who might not be subsidized and find the providers there? Next slide, please. Recommendation 5, that mixed delivery system is so key, ensuring they have livable wages so that they can literally put food on the table, keep the lights on. If we don't, just think, I love the fact that we always go back to Maslow's hierarchy of needs. If you can't put the food on the table and keep your lights on and ensure you have sustainable rent, you're not going to be able to even think about professional development and learning. So we need to really ensure that that's shored up. Going to a cost-based model of reimbursement for providers instead of market reimbursement will ensure we're not keeping poor groups poor, because with market rate, we pay the people what the parents can pay. Well, guess what? They're just starting out with their careers. They can't pay anything. And so that market rate is just not going to work. Looking for those basic needs. Those are primary before education. Direct cash transfer, CACFP, getting the food on the table, that is so key. And getting that hook in, like Katie mentioned, is so key to connecting with these providers and ensuring that program and policy changes involve the providers from step one. Next slide, please. And this is our team. You know, gotta recognize the folks doing the work to connect with the providers and the parents. And I just want to congratulate the team for pulling this together and uplifting the voice of our provider population. Thank you.
Thank you all so much. You've given us so much to think about. I cannot wait for this report to come out. So I want to thank Katie, I want to thank Susan and Olivia, and I want to thank all of you. We have many of our friends in the chat who have been doing this work for a very long time, either as the providers, as the researchers, as the supporting agencies. So thank you all for continuing to keep these families and these educators in your sights and in just this wealth of knowledge that we're going to grow from in these reports. So thank you so much. We do want to also let you know that, as Katie mentioned at the beginning, we expect this to be a living document. So as we find out other examples and initiatives that are out there, please feel free to send them to us at Build. We'll include them in the report. The report will grow and change as time goes on, and hopefully capture as many examples as we can, and to inspire others and help others know what's out there. We do want to let you know that in this year, we are going to go back to a monthly webinar. Last year, they were every other. Build's going to go back to once a month. And starting in March, we're going to kick off a series on why educator wellness should be a priority for early childhood systems in home-based childcare. So you won't want to miss that. And with that, we will also ask that as you exit, we shut down the Zoom, a poll will pop up. We use that information to tailor these sessions to what you want and to co-create them with you. So please give us whatever your honest feedback is, and we will take that into consideration. As always, thank you again and have a wonderful afternoon.